my contribution to Rural Healthy People 2030 was the chapter on health insurance in rural America. And this is chapter 17, and it's quite important to me personally to talk about health insurance because it is the main agenda of my research for the last 10 years. And I've been working on health insurance access since I started my PhD. And so there's always something new that one can learn about trends and how insurance coverage dynamics change for different populations over time. Researching this topic, I would say, highlighted two important findings that I actually didn't know as I was working through this chapter. Number one was that the uninsurance rate for Hispanic individuals was substantially higher than any other racial and ethnic group. To give you like a specific number, even today we're having about 30% of Hispanic individuals without health insurance under the age of 65. And this compares to the average uninsurance rate, which is close to 10% in the US population overall. And so this kind of displays there are disparities that continue to be existent and they will probably have to be addressed in the future. The second piece of information that I thought was really important and to highlight is to say that the mortality rates for rural Americans is substantially higher across the Southeast especially compared to similar individuals who live in urban areas in the Southeast. And so I think it's important to highlight that there are multiple challenges that rural residents face that even urban residents in the same state do not. But the magnitude of that difference was just not obvious to me. So I'd say looking at chapter 17 and looking at a nice US map that we have in there to really display the differences in mortality rates really highlights this finding. By 2030, I hope that disparities in insurance access have decreased dramatically, that rural urban individuals and residents across the United States and Texas have equal access to high quality health insurance, and more so I would say that people have access to adequate health care. We also know there are a lot of disparities when it comes to health outcomes, and many are rooted in the different levels of access to primary care and other outpatient care and inpatient care across the US. And so I think the goal has to be through federal funding and state funding to really make individuals aware of these substantial barriers to care for rural residents, and addressing that will become a challenge, especially as more people are probably migrating to urban areas as well. And so the remaining individuals in rural areas are facing a lot of challenges as well, but health insurance is definitely one that remains on one of the top of their agenda.